Hello, and welcome to Eastwind HealerCast. This is an opportunity to learn more about the expertise, experience, and excitement each of our practitioners bring to the services they provide for clients here at Eastwind Healing Center in downtown Iowa City, Iowa. We are a collection of independent businesses who share this beautiful, integrative healing space. We are offering this podcast as an opportunity to learn more about the services offered here at Eastwind, and this is for educational and entertainment purposes only. It is not a substitute for proper medical care or the initiation of a practitioner-client relationship. My name is Dr. Carrie Hoosman, and I have a psychiatric practice as well as a coaching and wellness practice under our roof here at Eastwind. It is my pleasure today to introduce to you Tammy Rich, BSN, RN, FMCHC, which stands for Functional Medicine Certified Health Coach, who will be sharing her work here at Upstream Functional Medicine. Welcome, Tammy.
Thanks for having me, Carrie.
You're so welcome. Thank you for joining us. So tell us a little bit, go back in time. How did you become a nurse? How did this nursing career start for you?
Well, it probably started actually as the dream of becoming a doctor. And then somehow I was, a conversation with maybe like a nurse mentor that I knew. And she's like, well, why do you want to become a doctor? I'm like, well, I really want to take care of people. I really love people. And she's like, well, if you really love people, you should become a nurse. So that was kind of what cemented in my mind. All right, I'll become a nurse. Well, and the explanation that as a doctor, you don't get a lot of time with people, and the nurses get more time with people. I'm like, okay, fair enough. So, so that's how I pursued nursing. Yeah.
So, you know, as you moved through your nursing path, and I can only imagine where you may have worked and how that all evolved, how did you then shift gears to
Mm,
start working in a functional medicine clinic? That's quite a jump.
it is. Yeah. And that's probably where the bigger story is for sure. So that experience, well, as a child, I really grew up in an alternative kind of mindset household that we ate really well and we did all those crazy, crunchy my parents were good hippies. And so, we did all of that kind of stuff, lived more of an alternative, holistic lifestyle. So I was already really keen on that way of living. And then skip to getting married and having children and personal experiences in our household where my husband got really sick. And that was our first introduction to Dr. Buchkina. We weren't sure what was going on, but debilitating joint pain, mystery things that we felt like, is he dying?
Mm.
And, we tried all the modalities. And somebody said, well, I found this functional medicine practitioner and she's at Southeast and you got to go see her. But our waiting list is like years long. And somehow there was a cancellation and we got in. And I still remember that first conversation with Dr. Julia and the look in her eyes and her actually listening and thinking, you know, therapeutically, what does this guy need? What's going on? So that was my experience with her. And then she tested him for Lyme disease and it came up positive. And so that just started us on a whole journey with that. And now he's doing well. And then skip to my son. uh, one, 1 years old, eating solid foods, got this complicated stomach bug, and went down the failure to thrive spectrum.
Mm.
So, some kind of intense personal family experiences, but she saved his life. And that's like, I don't say that lightly. And she did that with the GAPS diet and various things. But again, like we went down all the conventional medicine routes. We had the ultrasounds and we did the poop tests and nothing. Um, and saved his life with the GAPS diet. So 2 really intense experiences with Dr. Buchkina. And finally, I looked at her and said, I want to work for you. And at the time, she was about to go on maternity leave and start her private practice. So she's like, well, I'm going to have this baby and I'll call you. And she did. And the rest is history.
Oh, wow.
So it's been a pretty wild, grateful journey, finding functional medicine, finding her, and growing in my knowledge base since then too. Yeah.
Wonderful. Thank you for sharing your story, Tammy. Now, when you started working for Dr. Julia, did you you were just working as her nurse initially, or then and
Mm.
then added the health coaching later, correct?
Yes, yeah. So there is a coaching school that's the only one that works with the Institute for Functional Medicine, and that's the Functional Medicine Coaching Academy. And so they had probably had maybe 4 cohorts before me,
Okay.
classes, groups of students. And so I think they were fairly new. I may be saying that wrong. I'll have to find out. But yeah, so I joined their coaching program, and it's added immense value, especially in just how to coach, because as a
Hmm.
nurse, you wear a lot of education hats, and
Sure.
coaching is different. You're not educating, you're listening, and you're drawing out from the patient their innate ability to know where they want to go and what they want, and then you just help them get there. So there was a lot of that, just learning how to coach,
Hmm.
and then as well as the functional medicine principles. So the foundational principles in functional medicine is how you eat, how you move, how you sleep, managing your stress, um, and supportive relationships. 5 things, and we
Yeah.
talk about those with each patient. So learning more about that, and it really just blends beautifully with what Dr. Buchkina talks with people about, and then I'm able to just come right in and support them through it.
And really set them up for success, it sounds like.
Yes.
Awesome. Terrific. So, if someone's seeing a health coach, what does a session with you look like?
Yeah. So, COVID put a lot of that on to virtual,
Sure.
but even now that things are more, into a normal flow, we go grocery shopping. I can meet at patient's house and do like a pantry clean out. We talk over the phone, we goal plan, we game plan, we work on tools and tips and tricks, and we talk through ways maybe they feel like they aren't able to make changes, and we work all of those limitations out. So a lot of it is sitting and talking and working through steps to reach their goals. But then a lot of that too is, how do I cook? So I've gone also into patients' homes and helped them prepare a meal that maybe is on their new eating plan for the next 3 months, and help them with, swaps for, no, we're not going to do noodles, we're going to do zoodles, or we're going to do cauliflower rice instead of regular rice, and, how to get more vegetables in, how to cook protein. So it's, there's a lot of different things we can do.
Wonderful. It sounds like you're really actively involved in meeting them where they need to be met, which might be
Yes.
in their home or at the grocery store.
Yes,
So
exactly.
fantastic. And so this may be kind of a complicated question to answer. I'm not so sure, but what differences have you seen in patients who've sought health coaching with you versus, oh, yeah, I don't need that. I know what I need to do?
Well, we do have a kind of a spread of people who come to see us. We have people who you know, don't know what functional medicine is, but just know that they need help and they're not getting it.
Mhm.
And then we have people who have seen a functional medicine practitioner and they're well established in their lifestyle, and so forth. So my role does shift and change with people.
Got it.
But those who really come in, and I would say 8 out of 10 patients that would come in and see Dr. Buchkina any given month, new patients, definitely come out with like deer in headlight type of look, like, oh my gosh, we talked about so much, and we talked about all of these different things. I'm not sure which end is up. Those types of patients, my services really are well received and very supportive, just to take what she said, even further explain, or explain it again, because sometimes it didn't all absorb, like, what did this mean and what did she say, and just making sure they're getting off on the right foot. So the coaching, I think, for those patients is absolutely vital.
Mm.
um, making a 180 degree, 360 degree change in your life on, every level is intimidating. And coaching really comes in and puts that at ease. We put things in bite-size, doable steps. She wants you to eliminate 5 foods. Okay, let's start just eliminating 1 food. How does this impact your life? Where would this impact you most? Okay, let's find, we start plugging the holes
Hmm.
of where they say, oh, it's not going to work. It's going to be too hard. No, you can always figure it out.
Good.
So,
So you, again, meeting people right where they're at.
yeah,
Now, does someone have to be a current patient of Upstream to use your coaching services?
no,
So how does
yeah.
that work?
Well, number of coaching clients that I've seen that aren't patients of Dr. Buchkina, sometimes they'll come in with lab results, which I can talk to in a really general sense, what lab results look like and what we can do about some of them, um, just from a lifestyle perspective.
Like my hemoglobin A1C is a little bit
Yes,
high and I'm trying to
exactly.
not become diabetic. Got it.
What can we do?
Okay.
Um, Even for, hormonal challenges like my period's really challenging, what can I do? We can talk about lifestyle stuff for that. Patients who have specific health goals will reach out.
Okay.
Somebody who knows what they want but doesn't really know how to get there, or is getting overwhelmed by Dr. Google with conflicting information, and we can just really kind of clear out the clutter and work on a plan to reach their goals.
Oh,
So,
great. And now, obviously, with your license to practice nursing, someone would have to be in Iowa to see you, but that's a little different when you're a certified coach.
mhm,
And so can someone live wherever they want to? I mean,
you
how does that
can.
work? So you can see someone who lives out of state
Yes.
as a health coach seeking health coaching services.
Yes.
Okay. All right. Just wanted to clarify that.
Yep.
That's wonderful. And can you think of any like examples of, again, you've given several thoughts already about and examples, but any examples of people who may really benefit from health coaching services? Anyone else that when you think of, obviously, patients of Dr. Julia, people who've got a health goal that they're really wanting to
Mhm.
meet, but is there anything else you can think of that really sends up the flag for you, like, oh my gosh, we could do so much together?
Well, I always say that my ideal client is a newly married couple looking to start a family. And
Oh,
the reason why this is so important to me is because for me, for everyone who knows about functional medicine, it is the ideal medicine. It's the true lifestyle based preventative medicine. And it's like my whole heart is to create generations of health. And it's stuff that we're not taught in school. Um, we're not, it's like even some of our parents weren't taught these things. It's like, so how are we going to start passing down this knowledge of health and wellness? And I
hmm,
know that's so multifaceted, but that would be my ideal client. Outside of the other ones that we mentioned, is
hmm.
people looking to start their lives together in a really right, healthy, longevity looking way.
Beautiful. That is so amazing. So, I also know a little bit about this, but not a lot. So you're going to have to help me out here. So my understanding is that Upstream offers the optional, not required, opportunity of some health challenges. So not meaning more work, but meaning fun and engaging ways to meet
Yes.
health goals.
Yeah.
Can you tell me a little bit more about what these challenges are like and what it's like to be involved in this as a patient?
Yeah. So it's something we've started really with our patients, whether they're new patients or established patients or on our monthly support programs. And many of them are really easy and straightforward, like starting a new habit or detoxing your personal hygiene routine, And so we put out information and we share tips and ideas. And then it's like a community building opportunity and people participate if they want. And there's always something to win in the end. an office credit or a fun tool that goes towards what we were working on.
Great.
Um, and then we have more of like a community health challenges, which is our muscle building challenge. And that's one that we open up to the community. And it's a little bit more intense, but the protocol is really well laid out and people get great success. And so this muscle building challenge is one that we've created because you can run around everywhere and see weight loss as the goal, but really the importance of why we are prioritizing muscle building is because of what it does for your body overall, and how important it is. And so that's a really fun one. And you can also win, but the incentive to it's a little bit bigger than our monthly health challenges. So
Hmm.
this muscle building challenge is one that we put out biannually so far, but people have requested more often. So it might be something that we kind of put into the mix, provide more often.
Oh, wonderful. That's great. And so, kind of, getting us toward um, the end of our little interview here, is there something you wish, and again, this is your wish list, um, that everyone could do to help themselves, especially with the level of stress we have in our world today?
Hmm.
And so, if there is something, what would that be? What would you like to see people doing?
There's so many wonderful things we can do for ourselves. Um, Getting good sleep is probably key. We can't heal if we can't sleep. We can't manage our stress if we can't sleep. So that's one. Um, but then one that's really near and dear to my heart is just taking care of our metabolic health. So making sure our HbA1cs are not high and working on our diets, making it be a fun, delicious way of taking care of our bodies, because it can be. So those are two really important things to me.
Oh, great. I think I couldn't agree with you more, and thank you so much for sharing that. So, thank you again, Tammy, for joining us today and sharing more about the important work you're doing with Dr. Julia as her nurse and health coach. Potential clients can reach out to you with questions or to start working with you directly by going to Upstream FM, so frankmaryfm.com or eastwindhealingcenter.com, which will both get you to connecting resources, or email at upstreamfm@gmail.com. So thanks again for
Awesome.
joining us today, Tammy. And thank you to all our listeners for joining us as well. Have a great day.